January is Cervical Cancer Awareness Month, so we do have Dr. Whitney Goldsberry right here to fill us in on everything we need to know. First, if we could, let's start with the diagnosis and tell us a little bit about who's at risk.
Well, thank you for having me today. This is super important that we're talking about cervical cancer, not just because this is Cervical Cancer Awareness Month, but also the American Cancer Society predicts that in the U.S. alone in 2024, there will be almost 14,000 women who are newly diagnosed with cervical cancer, and nearly 4,000 women will die of cervical cancer this year. This is a disease that we can easily prevent with vaccination and can be detected with early screening. So it's super important that women understand the risks, such as smoking tobacco or not getting regularly screened, so that they're aware of that and can help prevent it.
So when we talk about some of the symptoms and when you would recommend someone to go see the doctor, what do you want women to be aware of?
Well, first off, prevention is the key to all of this. So getting regularly Pap screened, seeing your healthcare provider regularly is what you need to do. But then if you're ever experiencing symptoms like heavy vaginal bleeding, irregular vaginal bleeding, vaginal discharge, or pelvic pains, those are all really good reasons to go to the doctor and get further evaluation.
Prevention, very important. Go to the doctor regularly. We want to make sure people think of that one. Finally, treatment options. Can you tell us about these if you do get this diagnosis?
Right, so it mostly depends on how far advanced the cervical cancer is at the time of diagnosis. If it's caught early on, we can do surgery to help cure the cervical cancer. But if it's more advanced, we might need to do radiation, chemotherapy might be needed, or even immunotherapy as well.
But there are options.
Yes.
If you do get the diagnosis.
Absolutely.
And a quick reminder for people when we're talking about prevention, is this when you're going to the OBGYN, just your normal annual screenings?
Yes, that's a big part of it. OBGYNs will do routine Pap screening, which can help detect early cancer cells, which can then be removed so they don't progress into a cancer. But also the human papillomavirus vaccination is a really big part of prevention. This is a vaccine that is now approved for all people between the ages of 9 and 45 and helps protect against 9 different strains of human papillomavirus that can eventually lead to cervical cancer.
Excellent. Well, thank you so much. On the last day of January, it was the perfect time to do this.
Thank you so much.
Thanks for coming on.